We were already seeing the real impact still unfolding since the last 2 weeks after these two big earthquakes. And as you can imagine, people are terrified. They're really afraid of going into their homes already. And with this earthquake happening yesterday evening, I think they are even more scared now. And even it's only one earthquake, and it's actually less magnitude than the others. It's 6.4, but we see that it's been very shaky since last night, and it had also some impacts. Like we saw some collapsed buildings because we had already vulnerable buildings after these two big earthquakes. So apparently we also had more collapsed buildings now.
Yes. What impact has this had on the work that you've been doing there?
Actually, we already have a lot of staff on the ground. Turkish Red Crescent has more than 5,000 staff and volunteers on the ground in the whole area, not only one city, of course, because it affected the whole region. We continued our efforts after this last earthquake that we had yesterday. We were already on the ground, luckily, and we directly responded to the needs there.
Now, you've been working a lot in terms of trying to make up for the hospitals that aren't functioning, the medical needs that people have. Have you been able to continue doing that work, or did you have to reassess after this recent earthquake?
Unfortunately, 2 hospitals were evacuated because they had some very risky points in their buildings. And luckily, we had mobile clinics, health clinics, and we supported people who need health support on the ground.
Yeah. You talk about, the way people are feeling. What is your understanding of the long-term trauma that these people are going to suffer after not only living through this uncertainty, but then the lives that have been lost, the impact on the community?
Definitely. I think we need to highlight this even more in the upcoming periods. We are talking about needs like shelter, food, water, but as you just said, long-term needs are also pressing, like mental health. And we ourselves, like people on the ground, witnessing the situation, even ourselves, our staff also lost their loved ones, and they're also experiencing this themselves, so they know. And people are very stressed. But for this, Turkish Red Crescent, from the first day, assigned their psychologists to the ground, and they started to give psychosocial support to people directly. Also, they built psychosocial support service points in several areas in the region for children, for elderly, for everyone, to make them a little bit more better and prepare them for the long-term recovery.
Yeah. So, in terms of the physical help that people need, what is the most urgent need right now? Where are the efforts needing to be concentrated?
The most pressing need is obviously shelter, because it's winter, and the winter weather conditions are adding one more layer to all these challenges. And of course, we need tents and temporary shelter, but we also need to be thinking about long-term solutions when it comes to shelter, because the area is huge and devastation is really something on the ground. And other needs would be mental health, physical health, and we're already working on these on the ground. We already started from the first day.
Yeah. What are you hearing from colleagues, or do you have any colleagues working in Syria? Because they haven't even been getting even the basic level of support that the Turkish authorities are at least providing people in Turkey.
Of course, Syria is another context, but they also were affected by this earthquake severely, and they already had so much needs in the country because of the economic deterioration and all the things happening in the country. And this earthquake made another challenging point on their all burden. And as IFRC, we work with a Syrian Arab Red Crescent there, as we work with Turkish Red Crescent in Turkey. So they're also providing health services, and even they support the search and rescue very much. And they continue to be active on the ground for the people in Syria.
And Elif, in the area you at, has the search and rescue stopped and now it's sort of moved on to recovery?
We still see that there are some search and rescue efforts on the ground, especially after the earthquake yesterday evening. But I can clearly say that we are changing our focus to long-term recovery now, because we also have to take care of the survivors, and they need a lot of needs.
Yeah. Elif, appreciate the work you're doing and taking some time out for us. Thank you so much.
Thanks so much for hosting me.